Jessica DeMassa here at the HISA Studio at HIC 2017, and I'm with Jen. Jen, please introduce yourself.
I am Dr. Jen Bichel-Findlay, and I'm the current Director for Digital Health and Innovation in the Faculty of Health at the University of Technology, Sydney.
Okay, and what do you do for HISA?
For HISA, I have a number of hats for HISA. I've been a long-standing member. I chair the New South Wales Branch Committee. I'm a board director and secretary for the national board, and then I also chair the CHIA examination committee.
Fantastic. And so I'd like to talk more about that, about the CHIA exam, and as well as some of the work that you're doing in your day job as far as education goes in digital health and health informatics. So this is obviously a big topic here, workforce preparedness. So how are you approaching training this next generation of clinicians or health informaticians?
In my day job, we started with the undergraduates. So in most of the courses that we run in the Faculty of Health, we've embedded health informatics skills in their undergraduate course. So all the nurses have some exposure to informatics, not a whole lot, but at least some basic skills. The midwifery, all the other types of courses that we run. But last year we started a Bachelor of Health Science, and one of the majors in that is Digital Health and Analytics. So those are students that they want their career to be in digital health and analytics. So we're now running, it's the second year, so we've got two cohorts of students, and
Fantastic.
the third started last week. So,
Okay, so give me an idea of what kind of job a student can get with that kind of degree. What's the career path?
So they would either move into a health informatician position or working on a large EMR project team. They could also move into educating clinicians when an EMR is being deployed, or some of the other systems. And they can also move into an analytics position. That's a very new area in health, because we haven't had a lot of online data to be analysing. So that's quite an exciting area, I think, for a graduate if they like delving into data in a big way, like taking a deep dive into data and trying to look for trends that are going to help patients with their outcomes.
So talk a little bit more about the data side of this. So it's like, that is, like you said, it's emerging. We're getting access to more and more data, and there's deep learning, AI, and all of these things, and analytics is really a burgeoning field. So how do you develop a curriculum that prepares people for the unknown?
Yes, and that's been a difficult area, and we've had to, we tried having a transdisciplinary approach, so not making it feel like it's IT or it's data as such. It's trying to connect data to a human being. So we have tried to come up with different learning models, and not so much didactic lectures anymore at UTS. We have a new Learning Futures model. So it's trying to prepare graduates for activities that they actually would be doing in a job once they graduate. So we get them to play with big databases, we get them to look at trends, and it's just so exciting in health at the moment, because when you think about up to now, to look at anything to do with data, that was like a 9-12 month project. You'd have to get a project officer, they'd have to go down to medical records, pull all these charts, sit and try and read them, not read them, try and read them. That is just so labour intensive and takes so long, whereas now if we have the data online, we can actually get answers to questions in half a day or a day. And then we can use data visualisation techniques, which we do a lot of that in the analytics subjects. How do you visualise that data so you can persuade people who may not be really into data? How do you persuade them that this data is important and that should lead to policy change or practice change?
That's fantastic. So you're actually teaching them, too, the communication skills they need around that data so that it can become meaningful to the physician or to the clinician or to the hospital supervisor or the person running the business behind the healthcare.
Yes, because they don't like just numbers. That means nothing to them on a flat file. But if you can put it in an infogram or a corellogram or some sort of data visualization where a person doesn't need to have all that statistical background, just visually it's quite clear that A is better than B, and how can we move the people to A. So yeah, that's important.
So last question for you. I know you are chairing the exam committee for the CHIA program. So talk to me a little bit about the CHIA program right now. How are things going?
Oh, swimmingly. We've got 281 cheers now in the country, and we've got another 458 that are registered, that are studying and will be sitting the exam in the next 3 months. So that's fantastic.
What's your study tip?
Um,
From the person who's grading it.
Yes, my study tip would be to buy the textbook first.
And read it?
Read it and then register, because if you read the textbook, you would have been able to do your own gap analysis on the areas that you're not so good at. Whereas when I was the fourth person to get my cheer, and the textbook wasn't around then, you just had the study guide. So I think that would be my tip: buy the book now, and then when you've read it, register.
Good. Well, thank you so much for your good advice, very practical advice here. Jen, thank you for joining us in the HISA Studio. It's a pleasure to speak with you.
Thank you very much.
Thank you. This is Jessica DeMassa at HIC 2017.